to move on to solutions. So when it comes down to solutions, I just want to make sure that um, we understand that what we're talking about here is building an infrastructure that will connect all the players and make their transaction more fluid, and streamline their processes and procedure as much as possible and remove all the friction that we observe today. Um, we'll come back to this picture in our next slide. But now let's go through each of these specific problem and see what kind of solution we can bring to it. So when it comes down to the concept of identity, the goal here is really to understand that pseudonymity is insufficient in healthcare. We need to fully identify and verify any player in this field, whether that's a patient, a hospital staff, a doctor, a device to which a patient is connected to, or any other medical equipment for that matter. It goes all the way to all the companies, billing, claiming companies, pharmacy, insurance companies, and so on, and even medicine suppliers and manufacturer. So we need to identify each and every single of those players in such a way that we can verify their identity. So we have the tools today to do that, and decentralized identity, DEED, and self-sovereign identity, SSI, can definitely provide a solution to this problem. The next problem we will look into is health supply chain management. So here, when as a patient we undergo, let's say, no, what I mean here is that we need to implement a compliance and life cycle management for medicine, for example. We need to make sure that the waste we produce, because the health industry produce some very toxic and dangerous waste, and we need to make sure that they are disposed of in a very trustful way and specific way. So we need to make sure that any thing that is produced, any medicine, any drugs, any device that is produced has a clear process and step for making sure that all the parts that are put together to assemble it can actually be tracked down, and to understand their origin and to understand how they were made. So blockchain technology offer the tools today to do that. So that goes all the way to things such as distribution, going from the manufacturer to the customer. That drug that I'm buying, in which condition was it carried? Was this within the recommended temperature, and things like that. So we need to really leverage blockchain to control the supply chain, to manage the supply chain. The next one, which is the biggest one in my opinion, is patient record management. So the solution here is really about understanding that we can no longer function with only papers, and we need to make it easier on the patient side, in the sense that going around with all those big pieces of paper, while we have these massive Android phones that can where we can just install an app and even carry our record with us all the time, is just unacceptable. Um, you know, as I hinted before, here in Cameroon, the way the record is managed is the user gets a little booklet and he goes to the hospital. The doctor makes some notes in the booklet based on, you know, whatever service he gets there. And he has to carry that around and to other doctors or for his future visit or treatments. But the problem is we are talking about papers. They're not going to last forever. You know, they deteriorate and they can get lost, which happens often. Talking about my own case, and they can get stolen or destroyed. So there's so many reasons why we need to kind of keep all this information in one place. And of course, the fact that we can bring it into the digital world is really interesting in a sense that it then gives us, you know, real-time access to it. We can now do selective sharing. You know, patients have control over the medical record, of course, and they can selectively give access to part of it or to all of it to health institution they feel confident with. And this can only happen once we digitalize this, and they can have access to it at any point in time, any place. So that's the solution we can bring with the distributed ledger technology. The next point is the hospital information system, or in general, the healthcare information system, or all the institutions that are involved. You know, every hospital, every health institution has some kind of information system in place for their daily activities. The system enables them to do a lot of management, going from monitoring staff, doctors, equipment, and patients as well. And this system usually generates a lot of reports on treatment, on tests, in the case of laboratory, and also very often this report needs to be accessed by an outside player still in the field of healthcare, such as insurance, governments, health education institution, such as schools, for the need of a survey, and so on. So now there needs to be a way to make that all those interaction and sharing streamlined and seamless. There's too much friction at this point, and how distributed ledger technology can help us get to the point where we can easily share all this information to the benefit of all the interested parties. So now the good thing here is that we are talking about an infrastructure that already provides us with ways to make data immutable. So it gets even better because information we want to share, we want to make sure that information cannot be tampered with, no matter how it goes through, you know, different entities. We want to make sure it's the same information that we have at the origin. Now, the next point, health insurances. In many countries, not necessarily here in Cameroon, health insurance is mandatory for, you know, and many companies. And lots of employees from those companies have health insurance. And what happens is that um, usually there's no platform where we can make this process, we can automate this process in the sense that having a health insurance, signing up for a health insurance, first of all, is one big deal. And knowing which health insurance you can sign up with. And then when it comes down to entering a claim for a treatment, this process becomes really tedious in the case of Cameroon and Africa in general, because there's no really infrastructure to make this easy, both on the insurer side and on the patient side. So we often end up with claims that will be sitting there for years and years, and insurance not being sure about the validity of the data, insurance companies, and this just slows down the whole process to the point where nobody is the winner in here. Maybe the insurance company is the winner, and but patients is the loser. But the point here is that we need to make sure that we simplify these processes of insurance claim, signing up for insurance, and allowing hospital and insurance to, and many other health institutions such as pharmacy, laboratory, to exchange information, of course, with the validation of the patient. So next, compliance. Well, hospital usually are accredited by governing agencies. So compliance is definitely a required, compliance is required in the sense that healthcare is a very, very sensitive area, and there's a lot of regulation and laws around both drugs, supply chain, actors, and many other actors in the field, and there need to be a regulatory framework built into whatever protocol we offer through blockchain technology to make sure that we are exposing all those laws and laws to all the interested parties. So lastly, we have artificial intelligence. The idea here is to realize that as we have interaction between all the interested parties in the healthcare domain, there's a lot of data that is being created, and that data on its own has lots of clues within it, clues that can help us anticipate decisions, and very often because we can aggregate that data and recoup it and try to get it to talk, we can identify those clues. So artificial intelligence can come in here to identify recurring patterns, so that we can be notified when one of those patterns occurs or is about to occur. Artificial intelligence would equally help in stuff like allergies, detecting allergies, potential allergies, and many other critical aspects of healthcare that have been neglected, especially in our context. So overall, that's the big solution that we can think of when it comes down to healthcare management. So the last portion here is really about trying to understand how all of this can be put together. And as I mentioned at the beginning, it's really about building the infrastructure, and the infrastructure here being like blockchain, where the blockchain itself here at the center would serve as a storage mechanism, and which we will consider as the base layer. It will also define the consensus to validating all the transaction on the blockchain and persisting the data in an immutable way. So basically, it's the base protocol, and then on top of it, we'll have you know, a what I would call supporting application layer that exposes some recurring services or common services or common tools that will then be leveraged by all the interested areas or parties. So we can talk about, and smart contract services will be, you know, the portion of the application layer that will help us allow interested party to program contracts that can be executed in a later date based on certain conditions being met or being triggered by a given occurrence of some sort of event. So identity management services and membership services, this is really to allow any players to create its own like users and identify all of the players in its system, and also provide them with some sort of membership. So the interconnectivity portion of the application layer is just to make sure that all the system can interact with other system, providing, you know, a platform or a solution to the healthcare system. So it's more of a looking into healthcare system solution to healthcare system solution cooperation. The API and SDK portion here is to allow developer to query this system so they can build application, you know, for the big players in an independent way. You know, they can tweak their own application based on their own need. SDK again is for developers to work with. Blockchain as a service, you know, goes and then hand with you know, all the other services. And policy management is kind of like the base level for the regulatory framework at play in this specific context, the context in which we are creating this platform. So now all the other players around just, you know, plug in to all this, you know, core infrastructure to then build on top of it. And the infrastructure is there to make sure that it removes all the friction when it comes down to all these players exchanging information, and provide them with the tools to provide them with the supporting tools so that they can focus on their core functionalities. So that's the big picture of what we could build as a solution for the healthcare crisis we have now in many countries when it comes down to really managing data, patient record, and interacting with other players. So that concludes our presentation on this second case study. I hope it gives you an idea of what blockchain can do for healthcare, distributed ledger technology in general. We are currently working on a solution for this. It's probably going to take a long time, but if you are somehow interested in being part of this, you are welcome to send us an email at dit cameroon@gmail.com, and we can see how we can collaborate together. Next time when we meet, we will talk about some specific example of blockchain in healthcare and other places in the world so that we can, you know, see what other people are doing, how they're using this technology to solve problems in their local context. Matondo for being here. We look forward to having you in the next modules. I think we still have like 2 modules to finish, so we're getting close, and see you next time.